The forensic report carried out by PricewaterhouseCoopers, a private firm on Zambia's health sector, specifically on the Zambia Medicines and Medical Supplies Agency Zammsa, has continued to make headlines 2 months after it was handed over to the government. The Drug Enforcement Commission, working with the Anti-Corruption Commission and the Zambia Police, have made fresh arrests, with the latest being former Permanent Secretary in the Ministry of Health, Dr. Sivah Kachimba, 2 directors of private companies and 3 employees of Zammsa.
The arrests, therefore, bring the total number of individuals charged and arrested in this matter to 10. Now, colleagues, it's the intention of the law enforcement agencies to bring this investigation to a close so that policy directions are revisited to guide the medical supply services to avoid recurrence of what the nation has had to go through over the past, perhaps years, perhaps months.
With regards to allegations made by the U.S. ambassador to Zambia that 90% of pharmacists in Zambia are selling stolen medicines from Zammsa, ACC says none such cases have been uncovered during their investigations.
We were able to establish that, in fact, there was no conflict of interest because the board member, who we confirmed was a board member, actually never dealt with Zammsa. That was number one. The other thing we were able to establish is that Monica Banda, who's mentioned, Monica Banda, I gave you the name, is actually a fictitious person, if you like. She's never worked for Zammsa. She never worked for that. So the conflict there was rather misplaced. Regarding the supply of medicine, no, we haven't been able to establish what medicines were stolen from Zammsa. No.
A particular pharmaceutical company gets a particular medicine supply, and then they have, maybe it says from India, a generic drug. It has a batch number. Then maybe a government entity also gets the same medicine from India. It has the same batch number. Meaning you find this medicine here legally ordered from somewhere else with this batch number. Then this other medicine here also legally ordered. Now, to now differentiate the two, which one has stolen from the other. I'm just giving an example. That's what I'm saying. What we need to do now as a country is to work out measures that will curtail these crimes fully by way of maybe the use of modern technology as one of the possibilities.
However, stakeholders have maintained the call for government to make public the document in order for stakeholders to scrutinize the document and make their own independent verifications. Phiri for Diamond News.